Good morning. I'm Jim Ingle. I'm a professor of oncology at Mayo Clinic. I am the director of the Mayo Clinic Breast Cancer Specialized Program of Research Excellence and a program director within the Mayo Clinic Comprehensive Cancer Center in the Women's Cancer Program. My responsibility at Mayo is to direct breast cancer research. I want to thank you for the tremendous support provided by Greater Good. I thank you on behalf of myself, my co-investigators who work in breast cancer research, and most importantly, our patients for whom we're doing all this work with the hope of making breast cancer of historic interest only someday in the future. Mayo Clinic has been very active ever since the founding of the institution in breast cancer. At the present time, we have over 50 clinical studies for women with breast cancer, covering the full spectrum of the disease, from women at high risk of developing breast cancer to women who have early breast cancer and you don't want it to come back or recur, and also women who have metastatic breast cancer. A very important aspect of our research today is what's called translational research. Translational research is having the scientists who work in the laboratory making discoveries, working with the doctors who care for the patients. So our goal is to take the new advances, new discoveries in the laboratory, and then take them into the clinic. Now, this is the most effective and efficient way to develop new and better treatments. And Greater Good has clearly supported that. And I want to give you one prime example. Dr. Haluska is an investigator in our group who has been supported by Greater Good. Now, Dr. Haluska has been interested in hormonal therapy resistance. Now, why is that important? Well, it's important because hormonal therapy is really probably the most important therapy for the majority of women who develop breast cancer. Unfortunately, many of these breast cancers can develop resistance to this hormonal therapy. So Dr. Haluska has worked in the lab to try to find a way to overcome this resistance. And if we can do that, we'll have more effective therapies. Some women may not need to receive chemotherapy. So there's a lot of reasons to make our hormonal therapies better. Well, Dr. Haluska worked in an area called insulin-like growth factor receptor inhibitors. That's a long term, but it's a class of drugs that has been shown to be active in some breast cancers. Now, Dr. Haluska, working in the laboratory, looked at a number of different receptor inhibitors and found an ideal way to reverse this hormone resistance. And his data were so compelling that this has led to a clinical trial in patients that will be activated this year. Thus, with the support from Greater Good, Dr. Haluska was able to compress the time it takes to identify the best treatment. So, we work with advocates in breast cancer research. They, like us, want these advances sooner rather than later, much sooner rather than later. I'll give you one other example of the work we're doing in breast cancer research, and it has to do with pharmacogenomics. That's another long word, but what it means is that each of us has, in our genes, metabolizes drugs differently. Now, why is this important? One example is in the area of aromatase inhibitors, another long word. Aromatase inhibitors are, in postmenopausal women with breast cancer, probably the most effective hormonal types of treatments. Well, it's been found that you have variability or differences in how patients tolerate these aromatase inhibitors. What we found was that there are some women who take an aromatase inhibitor and feel fine. They have no side effects. Some, however, up to 10%, develop such severe joint and muscle pain they have to stop this potentially life-saving therapy. So we have done work looking across the entire genome. That's all 22 chromosomes and the sex chromosome, looking for differences between these patients who do develop these joint problems and those that don't. And we found some genetic variants that were associated with this. This was in about 900 patients. Then we took this information back into the laboratory and have actually found a potential explanation for this. Now, why is this important? It's important because it gives us clues on how to identify those women who will develop this problem, and number two, treat those and prevent this side effect in women who do develop these joint pains. That's personalized medicine. In the future, we're all a little different in the way we metabolize different drugs, and through pharmacogenomics we're going to find the best drug at the proper dose for the right patient. Well, we're very excited about the potential to make meaningful differences for women in terms of treating breast cancer. Ultimately, we hope to prevent this. We understand how important these funds are. They, in fact, allow us to do, as I've said earlier, compress the time it takes to identify the most hopeful therapies for our patients. We thank you very much.